looking at these numbers, alcohol disorder-related deaths of 20 to 25% over the last couple of years. Obviously, a lot of this data is related to the pandemic. What are some of the most meaningful data points you think that's come out of it?
Yeah, I think some of it is just looking at the specific increases in things like mental health symptoms, whether it's issues of depression and anxiety, and sort of the issues that people are suffering as a function of, inflation, food being more expensive and people just having a hard time getting by. And the reason why I focus on those issues is that all of those entities create more stress that people have to figure out ways of coping with. And oftentimes alcohol consumption is an easy way to try to mask any of those internal hurts that people are struggling with.
I was thinking about this. Let's say there are people out there who, are struggling maybe with coming out of an addiction that started during the pandemic. They may be confused possibly about what's happening, why they seem to be dependent on things that weren't dependent on before, maybe to go to sleep, just like you're saying, deal with stress. What is the best advice like that? Would you recommend like a therapist or a psychiatrist, who could provide alternative medication maybe, other than alcohol and drugs? What kind of care is best for someone whose addiction may have started in 2020?
Yeah, and that's actually a good point, because I think when we look at alcohol use, if we look at folks that were actually drinking before the pandemic but maybe didn't have sort of an addiction or a disorder that was diagnosable, we're actually seeing within just that group an increase of about 20 to 25% of alcohol abuse during the pandemic. And so if you think about what alcohol abuse consists of, whether it's binge drinking or heavy drinking, you actually are significantly increasing the likelihood of developing an alcohol use disorder. And once you're sort of in that space, you now need to think about, how do I get help? And sometimes you open up to a family member or to a friend in order to just start that conversation. But that can only go so far. And so that's when you need to sort of have engagement with professionals, whether it is a psychologist, whether it is a psychiatrist, and I would argue figuring out ways of doing many things, like working with a psychiatrist to get medication treatment, working with a psychologist or a social worker or some sort of licensed counselor that can help you gain skills through methods like cognitive behavioral therapy. But also thinking about a support group approach, whether it's a support group that is just you with others who are trying to work within their recovery, or also support groups that include family members and friends so they can figure out ways in which they can also support your sobriety.
What are some of the better ways people can suppress cravings? Like, what are some good things to try and focus on when it comes to shifting how you automatically think about when a craving comes up?
That's actually a good question. And so I think there are various strategies from a mental health standpoint. Like, some folks talk about ways in which you need to stop a cognitive process and redirect your attention to something else that's a little bit more healthy. And some of that stuff could also be engaging in things like exercise, or engaging in things like deep breathing exercises, or thinking about ways in which you can do yoga or any kind of mindfulness strategies that essentially can distract yourself from those cognitions that are constantly getting you to ruminate about having another drink. And sort of that rumination is actually one of the primary symptoms of a person that may be suffering from an alcohol use disorder, when they can't really begin to sort of think about things that are really critical at that moment in time and just obsessed about that next drink. But then maybe it comes at the risk of other more pertinent responsibilities, like things associated with running a family or going to school and or work.
Obviously, what we're looking at here is a study, a national study. But what can you tell me about the local level right here in Houston that you've seen really over the last couple of years when it comes to alcohol and drug abuse?
Yeah, I think it's been extremely triggered by the pandemic, and I think oftentimes we want to get into that narrative that the pandemic is over. And when you look at some of even just the pandemic data, we're seeing that the death rates are mirroring a year ago, and that's with only a fraction of the states that are reporting it. And so I bring that up to say that the issues associated with stress, depression, anxiety, even not being able to engage in pleasurable activities are at a high in Houston. And so oftentimes we turn to things like alcohol and other drugs because they're very quick acting, but we don't think about the long-term consequences, especially with like alcohol consumption. That stuff could affect your mouth, your heart, your liver, your pancreas, your bones, gastrointestinal issues. There's so much that can happen downstream, and you're not necessarily thinking, 5 years down the road, 10 years down the road, what are some of the chronic diseases that can come from this?
What about demographically? Have we seen specific groups, men over women, Latino over black, black over white? What have we seen in terms of the demographics of the data?
Yeah, this is actually pretty interesting. And so some of the biggest rates that we're seeing is sort of in college age students. We're looking at binge drinking, upwards of 40% amongst college students. One of the pieces that's also interesting is that when we think about binge drinking and heavy drinking, it has sort of a reverse trend that we would see with other major issues where that folks that come from more affluent families are actually engaging in these risky drinking behaviors at much higher rates. And I think when we think about, some of our more vulnerable communities, some of the challenges is less so the amount that's being consumed, because oftentimes we can look at, for example, folks in the African American community where their alcohol consumption levels are actually extremely low compared to national standards. But when you look at some of the biology and some of the lack of access to care and so forth, they become more at risk for some of the negative health consequences that come along with it.
For those people who don't have insurance, for those people who don't have the financial means to really get the care they need, what are some of the better options for that?
Yeah, and I think there's sort of a range of options. One is just being able to find a support group, and that can be free, right? That could be family, that could be friends, that could be spiritual leaders, folks that you can surround yourself around to kind of get off of your chest those things that are bothering you. Because oftentimes when we think about alcohol consumption or drug use, it's really masking something else that we haven't found an outlet to sort of address. I think if we go on to some of the federal organizational, websites, whether it's the CDC or NIH or SAMHSA, there's oftentimes toolkits that can be downloaded that can sort of give you some good behavioral and cognitive strategies for addressing these things at no cost. And so, when we think about some of the current science that's being developed, within our Health Center for Addictions Research and Cancer Prevention, as an example, at U of H, we're developing app-based platforms where people could just download an app and figure out ways of managing transdiagnostic vulnerabilities, whether it's dealing with stress symptoms, whether it's dealing with anxiety symptoms, to where you can get that quick feedback of how can I deal with this from a cognitive or from a behavioral skills standpoint in order to reduce the urge of needing alcohol as my only outlet from coping. And so I think as scientists, we're also trying to figure out ways of getting around this sort of financial gap so that all those that need help can get it.